Good morning. Welcome to OB. We're going to walk through this course the way a pregnancy progresses. We're going to start with prior to becoming pregnant. We're going to talk about the changes in mom's body and what you as the nurse can do to help her deal with those changes so that she has a healthy outcome. We're going to talk about labor and delivery. We're going to talk about postpartum. And then finally, we're going to end the course talking about our newborn. So let's get started. First, we want mom to have preconceptual healthcare counseling, and that usually is a doctor's appointment or maybe to the nurse midwife or nurse practitioner, because we want to get mom in the best condition we can get her in so that she has the healthiest pregnancy possible. Sometimes our moms have diseases that they're not aware of, such as diabetes, maybe high blood pressure, sexually transmitted disease, a thyroid condition. We would want to know about that, get those treated, get those in good control prior to her becoming pregnant. If she already has those diseases, we want to make sure that those are in good control so that we can ensure a healthier outcome. Sometimes if she's got these diseases, some of the medications she's on may not be conducive to the healthiest pregnancy, so we would want to change those to different medication that would be easier and safer to use during the pregnancy. Now, we know that all women don't go to see their doctor, because why would they go if they're feeling well? You know, a lot of our pregnancies are unplanned, so they get pregnant, and it's only once they're pregnant and that they come in for prenatal care that they find out they have these health conditions. So how does this whole process start? Well, fertilization and conception, first understand that those are the same terms. They mean the moment that that egg and the sperm get together. It requires favorable vaginal pH and favorable cervical mucus. Now, women have cervix, mucus around their cervix at all times. It kind of protects from invading organisms from the vaginal tract. But that mucus changes throughout a woman's cycle. And so it gets thinner as they get closer to their period. And as it gets thinner and this more watery consistency, then that allows the sperm through into the cervix. It requires access to the cervix. It requires mature sperm, and fertilization occurs in the ampulla, which is the outer third of the fallopian tube. So here's a picture, and here's the ovary, and the egg getting mature, bursting, and then it gets into the fallopian tube. And it occurs in this part of the fallopian tube where fertilization occurs. And as you can see, it starts to divide immediately as it travels down to the fallopian tube and as it enters into the uterus. So implantation is a mass of cells, and that mass of cells is called the morula. It reaches the uterus about 72 hours after fertilization. Then about 7 to 10 days after conception, portions of it begin to dig into the endometrium, the lining of the uterus, and that's implantation. Now, some women are going to experience implantation bleeding, which is as this morula embeds into the uterus, there's a little bit of bleeding that may occur, so mom's going to have a little bit of spotting. It should not be major bleeding, and this is called implantation bleeding. Now, women will come in and we'll ask them when their last normal menstrual period was, and they'll say, well, the last normal one was in January, but in February I had just a little bit of spotting. It only lasted a day. And so we don't consider that typically a period if it wasn't like her normal period, and we consider that in February as the implantation bleeding. So how do we date a pregnancy? A pregnancy lasts 10 lunar months, which is a period of 4 weeks. It is 9 calendar months, 40 days, or 280 days, 40 weeks, or 280 days. So we have some new lingo to learn here in OB. EDC, and you will see that in multiple places throughout this course and throughout your clinicals. EDC means estimated date of confinement. That means their due date. So we also have EDD, EDD, estimated date of delivery, and EDB, estimated date of birth. Those are all referring to mom's due date. Then we talked about, like we said, the LMP, last menstrual period, last normal menstrual period. And we date our pregnancy based on the 40 weeks from the last normal menstrual period. Development of the embryo. Once all this is dividing and replicating and dividing more, embedding into the uterus, it starts to develop the amniotic fluid. All those cells are going to develop and have a yolk sac. That yolk sac is there for the first 2 to 3 weeks, and that is actually what feeds this whole thing and provides nutrient to this developing fetus prior to that placenta getting fully embedded and fully developed. All these dividing cells result in an umbilical cord. An umbilical cord has Wharton's jelly around it. That is, it's really tough connective fiber that surrounds the vessels in the cord to protect those vessels in the cord. And we call that white stuff around the cord Wharton's jelly. Then it starts developing the placenta, starts embedding into the uterus, starts developing the structures of the placenta starts to function, and it's going to now take over as the respiratory center, the waste center. It's going to act like the kidneys, getting rid of the metabolic waste from the kiddo, and that placenta is going to start secreting the human chorionic gonadotropin. That's the HCG, which we use to, and that's the basis for most of our pregnancy tests. We have this embryo. It has a yolk sac. It's a secondary cavity that develops about day 8 or 9. It aids in transferring maternal nutrients and oxygen to the embryo during that first couple weeks of pregnancy until the uteroplacental, the UP, circulation starts to be established. The heart starts to beat and circulation begins by the end of the 3rd week. Now, typically we cannot hear any of that. We cannot hear baby's heart rate that early. The cord is responsible for the transport of the maternal nutrients by about day 14. And so here's a picture, and if you can see right here is a yolk sac. That is what is feeding this kiddo, this developing fetus right here, until that placenta starts to function. Here's another picture of one. Here's another picture of one. That's going to go away by a couple 2 to 3 weeks into the pregnancy once that placenta is fully embedded and can actually feed that kiddo. So the embryo and the fetus, just to continue, the development of the embryo lasts from about day 15. Up until then, it's called that morula, remember. Okay, so it lasts from day 15 to about 8 weeks after conception. And at that point, the crown, which is the top of the head, to the rump, that length is about 3 centimeters by about 8 weeks along. At the end of the 8 weeks, all organ systems are already present in this fetus. And from 8 weeks and through to the 40 weeks of pregnancy, all the organs are already there. Now they're just going to mature in function and structure. There are membranes, which is the sac that surrounds the baby, and it is where the amniotic fluid is. There's 2 parts to those membranes. One is called the chorion and one is called the amnion, and the amnion contains the amniotic cavity. So let's talk about what those membranes look like. If you were to take 2 pieces of saran wrap and put them together, they're kind of stuck together, and so you can move them around and they're going to stay together, yet you could actually get them and separate the 2 pieces. And that's kind of like the amnion and chorion. It's a very, very tough structure. There are 2 different layers, but they're kind of stuck together. And the best example I can give for that is like the chicken skin. The skin is different than the chicken, but they're still stuck together. However, at some point you could actually separate the skin from the meat itself. And so They're kind of fused, but not fused to the point that they cannot separate. So the embryonic stage, which is up through that first 8 weeks or so, is the most crucial time for development of the organs and external feature. This is when the baby is most vulnerable to teratogens. So anything that occurs in this first 8 weeks can have significant impact on whether we actually develop and the systems that we're supposed to have. This is when things like the neural tube defect occurs, is in this first 8 weeks. And it's because mom didn't have enough folic acid. We could have such insults in this time frame from medications or from diseases that it insults the system so bad that it impacts this developing fetus. This would be when we have things like anencephaly, where babies are developed and they have brain stem, but they don't have the full brain. And it's during this embryonic stage. So what is a teratogen? It is a non-genetic factor that causes malformations and disorders in our kiddos. The things that we know can impact this pregnancy and the development of this embryo are drugs, legal and illegal. Some of our psych medications are not healthy during the pregnancy, and we would need to change her to a different medication. Some of our asthma medicines. So drugs, chemicals, infections, a sexually transmitted disease can cause significant injury to our kiddo. Syphilis, for example, can cause bone lesions that would make these bones not grow appropriately. Exposure to radiation, heavy metals, and certain maternal conditions such as infections or high blood pressure or a collagen vascular disease, those can all affect this developing fetus. So a little bit more about our membranes. We have the amnion, that's what covers the umbilical cord and fuses with the chorion on the fetal side of the placenta. Remember, amnion and amniotic fluid, that's the part that's closest to the baby. And then we have the chorion, which is what actually embeds into the uterus that causes and eventually becomes the placenta. And it's the other part of the membranes. Picture of a placenta. This is the example that I was telling you about, where the amnion and chorion, they're two separate structures, yet they're kind of fused together, but they can be separated. And so this right here is the placenta itself, and this is the umbilical cord. And this is the white stuff that I was telling you about that is called the Wharton's jelly. It actually surrounds the vessels in the cord. So the vessels go from the placenta through the umbilical cord to the baby, and that's where all the gas exchange takes place, and that's where the waste is picked up and transported back to mom, so mom can get rid of that waste. So this white side, this smooth side, is called the amnion. This is the amnion. And the chorion is this rougher side over here that is what it is, the placenta that embedded into the uterus. Again, the rough side is what attaches to the placenta, attaches to the uterus. The smoother side is the fetal side. And again, here's the fused amnion and chorion. Although this looks pretty thin, this is a pretty strong structure. It can withstand a whole lot. If you think about how much a baby moves and kicks and how many times mom bumps her tummy on a counter or something, it can withstand a lot of pressures. It's full of that baby, it's full of all that amniotic fluid. It moves around as mom moves around, it gets jostled. And that amniotic fluid is to help protect that baby. But I want you to understand just exactly how strong that structure is. Amniotic fluid, it's derived from the fluid that comes from mom through the placenta, and it's the outflow from the fetal lung and fetal urine. The fetus swallows and urinates at ever-increasing volumes, so that they're between 700 and 1,000 mLs of amniotic fluid at term. And when we think about it, and when I used to teach the online or the on-campus group, students in the class would go, "Ooh, he swallows urine." It's sterile, so it's not an issue. Amniotic fluid abnormalities, we can have too little or too much. Oligohydramnios, remember oligo means little, oligohydramnios is less than 500 mLs. Hydramnios on the other side means that we've got too much amniotic fluid, more than the normal. Now you may see in some places, and you may hear people talking about polyhydramnios. That used to be the term we used. They've changed it, and we're supposed to be using the term hydramnios because that more accurately defines what's going on. So too little can tell us that we have an issue with our kiddo. It could be a respiratory issue or a urinary system problem, and it usually occurs from a placental insufficiency. There's not enough good blood flow through the placenta to feed all the nutrients and oxygen that our kiddo needs. On the other side, too much fluid can indicate maternal diabetes, a neural tube defect, or other central nervous system defect of some kind. Can tell us chromosomal abnormalities or a GI issue. And so sometimes when they're just doing normal routine ultrasounds, basic ultrasounds, just to make sure baby's growing, and they note this amniotic fluid abnormality, it would lead them to do a much more detailed ultrasound to evaluate what's going on with this pregnancy. So what does it do? It helps cause thermoregulation, so our baby stays whatever temperature mom is. It's oral fluid. Like we said, it's a cushion if in case of trauma. It allows freedom of movement for musculoskeletal development of this kiddo. It allows them to move around in that fluid, keeps that uterus from binding them too tightly. And it's required in order to have fetal lung development. If we don't have enough amniotic fluid, baby can't breathe and swallow that amniotic fluid. Therefore, their lungs end up with hypoplastic lung disease because they didn't have enough fluid. It contains albumin, urea, uric acid, creatinine, lecithin, sphingomyelin. Try saying that 3 times real fast. Bilirubin, fructose, fats, leukocytes, proteins, epithelial cells from the surfaces that it encounters, enzymes, sometimes some lanugo, which is that fine downy hair that we see on our preemie babies. And all that is perfectly healthy because all of that is sterile and the baby's body can tolerate that, breathing it in, breathing it out. Let's talk about the umbilical cord. 30 to 90 centimeters at term. It contains 2 arteries and 1 vein. The arteries carry blood away from the fetus. It carries deoxygenated blood. And this is the only time arteries are going to carry deoxygenated blood. So it's actually reversed in the umbilical cord. So the arteries carry deoxygenated blood, and the vein carries the oxygenated blood from the placenta into the fetus. And then we talked about that Wharton's jelly that prevents compression of these vessels. So here's a picture of the placenta. Here is where the cord comes off of the placenta to go to the kiddo. This is where it embeds into the uterus. Every time mom's heart beats, these little things right here, these are called pools, fill up with blood. And so this is part of the fetal structure. It right here at this surface is where the gas exchange takes place. So it picks up O2 to take to the kiddo, and it brings baby's waste products and drops it into this pool right here. So this membrane right here acts as the lungs to carry the oxygenated blood and get rid of waste products. And so then it gets absorbed by mom, and then mom's body takes care of it. So what does the placenta actually do? It acts as the respiratory center, the nutrition center, all the building blocks for kiddo, all the proteins for muscle development and all that, the fats, the carbs, all that comes across at the placenta site. It acts as the excretion site, and it actually stores carbohydrates, proteins, calcium. It stores a lot of the vitamins and iron that's going to be needed as the pregnancy progresses. Placenta is pretty fascinating. So fetal maturation, the fetus starts at about 9 weeks. Now, if you'll remember, what did we call this fetus prior to the 9 weeks? If you remember, prior to the 9 weeks, we called that an embryo. So up to 8 weeks, 8 to 9 weeks, this is an embryo. Starting after 9 weeks or so, it is now a fetus. And it will be a fetus until it is delivered. Once that fetus is delivered, it is now a newborn. It is no longer a fetus when it is on the outside. So fetal viability is the capability of the fetus to survive outside the uterus. That occurs approximately 23 to 24 weeks gestation, and that is currently the time frame that is popularly used for an age of viability. Now, I do know several of our facilities in the Metroplex, and I'm not sure in like the Houston area, San Antonio area, I'm not sure what they're calling viability, but I know a couple of our hospitals here are admitting babies as young as 22 weeks to see if we can push that age of viability a little bit further back so that if born a little bit earlier, they have a chance of survival. Now, chance of survival does not mean that these are normal newborns by any stretch of the imagination when they're born at 23, 24 weeks, 22 weeks. It means that they're born, they're going to be supported with a ventilator. They've got to have TPN because they can't suck and swallow. Their gut's not mature enough to absorb nutrients, even if we put it down like a feeding tube for them. So it just means that we can keep them alive with very intensive care to get them to where they can go home, hopefully. And maturation starts from a head to the foot, so cephalocaudal direction. Alright, so here's a picture. Please don't try to write everything down here because I'm not going to make you know when the heart and the upper lip and all those kind of things. I just wanted to show you that different systems are insulted at different time frames. Across the top over here is how mature this fetus is. This is kind of showing you how they have developed up through those time frames. And then these down here at the bottom are telling you when we have specific insults causing problems to specific things. So if we notice on this top one, if we're having insult in this first, 5, 6, 7 weeks, then we can end up with neural tube defects. Over here at 8 to about 16 weeks, if we have an insult, then we could have a kiddo that has mental retardation. But if we notice down here, look at the cleft lip. If there's an insult that occurs prior to 4 weeks, it can impact the cleft lip. Whatever insult happens between the 4th week through almost the 7th week, an insult during that time frame can result in a cleft lip. After that 7 weeks or so, then we're going to have defects, may have defects in the upper lip. But after this 8-week time frame, an insult is no longer going to affect the palate or the lip. Okay? So this is just, I want you to see how different things at different time frames in this pregnancy are going to impact. Again, down here, prior to the 7 weeks or so, an insult is not going to affect genitalia. But an insult between 7 weeks and 9 weeks can, and after 9 weeks or so, then it's just going to impact the external genitalia. Fetal circulation is very different than neonatal circulation. Remember, neonatal is once our baby is born, and it's a fetus up until the minute that it's born. And it contains structures that are going to bypass the fetal lungs. If you remember, all the gas exchange is taking place at the placenta, so the blood does not need to go to the lungs in order to get oxygenated. There's going to be blood flow to the lungs, and that's just to keep the lung tissue healthy, to feed the tissues of the lung, but the majority of it's going to bypass the lungs to go to other organs, such as the brain. And so we have a ductus arteriosus that connects the pulmonary artery to the aortic arch, a ductus venosa that bypasses the liver, and then the foramen ovale that shunts blood from the right atrium to the left atrium. And those are all going to significantly change, close, and go away once this kiddo is born. Respiratory system, it starts forming at about week 4, and the respiratory movement started about week 11. Kiddo is breathing in there, but he's breathing in that amniotic fluid, which helps to develop the lung structures. Week 6 to 24 continues to differentiate the structures. Functional alveoli and surfactants started about week 24 to term. So this is why one of the reasons we say that fetal viability is about week 23 to 24. Because can you imagine, would a kiddo have a chance to survive if they did not have alveoli? Think about where the gas exchange takes place. It takes place at the alveoli. And so without having any of those, there's no possibility that this kiddo could survive. Fetal lungs produce the fluid that helps inflate the alveoli, as well as fetal urine. And then the vaginal birth squeezes out about 1/3 of that fluid from the lungs. This means that infants born by cesarean section may have more respiratory distress. And this is going to be really important as we move through this class and we talk about delivery and delivery types, and as we talk about some of the risks to our newborns and our newborns that are at risk for respiratory distress based on their delivery history. Pulmonary surfactants. Remember, we talked about the lungs continue to develop functional surfactant and functional alveoli starting at about 24 weeks. Each kiddo's a little bit different. Some maybe 23 weeks. We have seen that occasionally a 22-week might have some functional alveoli. When we're talking about averages in OB, that's about as close as we can get because our babies don't read the textbook and they're all going to mature along their own little time frame. So a kiddo that has been exposed to chronic hypoxic stress may have increased fetal lung maturation, where the kiddos that have gestational diabetes or have been insulted by mom's chronic glomerular nephritis may have decreased maturation of the lungs. So those kiddos are going to be more at risk for respiratory distress once they're born. Surfactants decrease the surface tension of the alveoli and are required for extrauterine survival. If they aren't mature enough to have started to develop these surfactants and have alveoli, no amount of intensive care in our NICUs are going to help them survive. Neurosystem, or neurologic system, the neurotube starts to develop very early on. So what should our moms be taking? Can you think back to health promotion? They should be taking folic acid. And when should they start taking it? Prior to conception, right? This the neurotube closes about day 17 to 30 days. So a lot of times mom doesn't even know she's pregnant at this time, and by the time she realizes she's pregnant, the damage has already been done, and there's nothing we can do to reverse that. So since 75% of our pregnancies are unplanned, all women of childbearing age should be taking folic acid. Central nervous system damage can occur as a result of poor nutrition or hypoxia, drugs, those teratogens that we talked about, infections, traumas. Blood system. Blood starts to form in the yolk sac beginning at about week 3. Stem cells start to seed the liver, and hematopoiesis begins in the liver at about week 6. ABO and RH antigens are present by about week 6. The GI tract structures develop at week 5 to 6. Swallowing and gastric emptying begins about the 5th month. This is when they start having meconium, which is that first stool that our babies have that's in their GI tract. The GI system isn't mature until around 36 weeks. So any of our babies that are like 23, 24 weeks, their GI system isn't mature enough to extract any nutrient from anything that we would put in their GI tract. They certainly can't suck and swallow, but if we were to put fluid, any like breast milk or formula in their gut via an NG tube or an OG tube, their body is not mature enough to extract nutrients from it. So they're going to have TPN and lipids IV until such time their GI tract is mature. Renal system. Kidneys form in week 5 and begin functioning in week 9. The urine adds to the amniotic fluid volume. In fact, that's where most of the amniotic fluid volume comes from. Kidney function is not required by the fetus. Remember, all the waste removal and all that kind of stuff is done by mom at the placenta. But it is required by the neonate immediately after birth. Reproductive system, male, the testosterone is secreted. Testes begin to descend into the scrotum by about week 28. Female, oogenesis begins about week 16. Fetal endometrium responds to maternal hormones, which may result in pseudomenstruation after these kiddos are born, which is a little bit of mucousy blood. And they can have witch's milk, which is actually a little bit of colostrum from baby's nipples. Musculoskeletal system, the bones and muscles begin forming by week 6. Muscles start contracting spontaneously by week 9. So the kiddo is very active in there, but mom doesn't usually feel it this early because there's lots of room in that gym that they're not bouncing into walls yet. So although baby's moving and muscles contracting and they're stretching and all that kind of stuff, mom typically doesn't feel it this early. Talked about lanugo just a little bit ago. Lanugo appears about week 12 and covers the fetus by week 20 and begins to start thinning out by 28 weeks. And lanugo is fine, that real fine, downy, kind of peach-like fuzz on our baby's skin. So one of the ways we can tell how old a newborn or how mature a newborn is by how much lanugo they have on them. They also have vernix. That's formed from sloughed cells and secretions. Again, the amount that's on our kiddo helps establish the gestational age. Vernix, the best way I can describe vernix is that it looks like somebody's taken a handful of lard and slathered it all over our kid. It is this real thick, cheesy kind of substance that's stuck to their skin. We don't know why it's there. We think it's probably to protect that immature skin being in that water-filled environment, but we don't know. So keep these milestones. You don't have to memorize them specifically. I'm not going to ask you what happens at 22 weeks, but you need to know that we consider age of viability 23 to 24 weeks. I want you to keep these milestones in mind as we talk about the normal and the high-risk changes and conditions that occur in this pregnancy. And this will help you understand the risk to our newborns if they're born too soon, and why we intervene to keep mom pregnant as long as the internal environment is still healthy for our kiddo. The changes that are going to occur within mom's body and the growth of the fetus is phenomenal. From the time she finds out she's pregnant and she goes through all this change, this developing fetus, This unique change that mom goes through in order to have our baby is just phenomenal. Moms are amazing creatures that they can develop this baby. And that's the end of this lecture.